All right, let's move to some better news. Over 350,000 jabs in one weekend. That is a big jump on previous weekend vaccination tallies, which have been lower than during the week until now. And that's all part of government's push to get as many adults as possible vaccinated before the fourth wave of COVID-19 hits us. So the infection numbers are low at the moment. This is great news. Just 429 new reported cases in the past 24-hour cycle. 39 deaths, which is lower, but it's still very tragic to hear. And we have learnt, of course, that we cannot take this virus lightly, even when we are coming off a third wave. Let's discuss this all now with the Director of Vaccines and Infectious Diseases Unit at Wits, Professor Shabhir Madhi. Prof, thank you for your time. So looking at the COVID infection numbers, we're through the worst, are we? But I suppose the big question is for how long?
Good evening, Sally. Certainly for this particular resurgence, I think we passed the worst. The positivity rate is less than 5%, and that is really where we want to be. The question of how long depends on a number of things, but just based on what we experienced the first 3 times round, I think it will probably be at least another 4 to 5 months before we experience another resurgence, unless there's some major shift in terms of the mutations of the virus, as well as if people become reckless, especially when it comes to gathering indoors in poorly ventilated spaces, particularly of unvaccinated individuals.
4 to 5 months, that's quite a long gap. That takes us through the festive season. And you say unless people, of course, are reckless, unless there are mutations. Do you have concerns about the easing of regulations, allowing 500 people, I think, to gather indoors?
The indoor gatherings certainly are of concern, and particularly if there isn't any sort of measures put in place to ensure that people that are gathering indoors are adequately vaccinated. The outdoor gatherings, fortunately, are much less of a concern because there's adequate ventilation, and 80% of all infections are either directly or indirectly related to people gathering indoors. So it's really the indoor gatherings which should concern us. And I hope that when political parties are electioneering, that they hold those sort of activities outdoors. And if they do hold it indoors, then they need to ensure that whoever's coming by are adequately vaccinated.
We saw over the weekend 350,000 doses given out, which is great news because for a long time our weekends have been really low with vaccinations. But generally we're seeing a bit of an easing off in vaccination rates, and we've just got to keep up the pace. Otherwise we're not going to prevent a really bad fourth wave. Are you encouraged, though, by what you're seeing in terms of government's push to get more and more people vaccinated? Do you think that at least we're heading in the right direction?
Absolutely. The more people we get vaccinated, we're certainly heading in the right direction. But at the same time, I think what we can't drop the ball on is to ensure that people above the age of 50 particularly are adequately vaccinated. We need to get at least 90% of people above the age of 50 vaccinated, probably by the middle of November, for there not to be major increase in hospitalization and death when we do experience another resurgence. So yes, we need to be all-encompassing in terms of getting vaccines into the arms of people. But at the same time, we can't miss out on the primary focus, which really should be focusing on individuals above the age of 50 and getting that figure to 90%. And at the moment, unfortunately, we're just above 50% for people above the age of 50.
Yeah, and I think for people over the age of 60, we're closer to 60. But as you say, we need to be hitting 90% of that population group. Talk to me about the booster shots. We know that other countries that have already fully or almost fully vaccinated their populations are now looking at booster shots. And that is obviously because after a while, we do know that immunity wanes from a vaccine. But interestingly, there's also talk that we now need new formulations to deal with the new variant. So my question to you is it as simple as just getting a third shot sometime when our immunity wanes? Or do you think South Africa rather needs to wait until we've got a new formulation, an updated formulation that can deal with Delta, for example?
Yeah, so I think the issue about a booster shot is that the jury is still out as to who exactly requires it. People above the age of 60, 65 might well require it, and certainly people with the medical conditions which causes the immune suppressed to be inadequate are people with cancer, as an example, or renal failure. They require booster shots, and that is to optimize the protection against severe disease. Providing a booster shot to prevent infection and mild illness is unlikely to be sustainable, even in the United States. So the booster shots really need to be targeted to those individuals that have immunosuppressive conditions that don't mount an adequate immune response even to 2 doses of the vaccine. With regard to other vaccines, there certainly is a lot of work taking place currently, and probably in a few months from now, we'll have at least the first of the next generation of COVID-19 vaccines that will probably be a bit more robust when it comes to even protecting against infection and mild disease due to variants that currently exist or new variants that evolve.
Thank you so much for your time this evening. Director of the Vaccines and Infectious Diseases Unit at Wits, Professor Shabhir Madhi.